mobilization, or AC mobilizations, is the anterior to posterior, and second, I would say, is the caudal. Posterior, frankly, I never use. I don't know if you do, Jason. It's very difficult to get your hands under there, and I'm not going to pretend like I'm good at it, because I'm not, but it just really isn't used that much. So that's the one that I guess you're allowed to be kind of lousy at. Okay, so what we're going to do is palpate along the clavicle. Going to find the most lateral point, right, of the acromion there. And what I tend to do is I go then just a little bit medial to that, actually on the clavicle. And the reason why I do that is because it's more comfortable for the patient, but you're achieving the same thing. Okay? So let's start with the AP. So I'm going to use my thumbs here, thumb over thumb, but I'm really using my trunk. You okay with that pressure?
So you're pushing on the acromion?
Yeah, right over the AC joint, just medial to the AC joint, right on the distal clavicle.
Oh, clavicle, okay.
So your trunk does the movement. And if it's ouchy for the patient, move the soft tissue out of the way and try it again. Okay, if you use your trunk, it should be less painful than if I do that, right? So if it's all thumbs, it's going to hurt. So that's AP. PA, we will just come underneath here. And this is a little more uncomfortable too. That looks cute.
Same thing, clavicle.
Yeah. So you want to make sure you're right at that, right at the AC joint itself, you know, right where the distal clavicle meets the acromion. I'm not going to do it way down here. It's not going to have the same effect. Okay? So that's PA. And then caudal, trunk is here.
Same position.
Same position, thumb over thumb. This is also a good one for overhead, the caudal, to restore more end range flexion.
Are you mobilizing
The SC joint, these can be really, really sore. So if my glenohumeral joint mobs, my scapulothoracic, and my AC joint mobs aren't getting me where I need to go, then I'm going to look a little bit closer at SC joint. I don't do these as commonly. I usually don't need to. But if someone has a broken clavicle and it's healed, I'm definitely going to start moving the SC joint. All right, so caudal, while I'm here, I'm going to do AP first. You okay here with this pressure? So thumb over thumb. Cephalic, you just want to make sure that you're moving the soft tissue a little bit. And this one, you're not going to feel a lot of movement at all, right, in the SC joint. So you'll feel the most with the caudal and the AP. Cephalic, you're hardly going to feel anything at all. But you just want to make sure that you move that soft tissue out of the way so it's more comfortable. And then caudal, I just usually will tell my patient, I'm going to place my hands here. If you're a guy working on a female, you might want to put a pillow or a towel roll or something under your hands, okay, so you're not right here.
Very important.
Female on female, you know, we usually don't mind, but I try to just keep my hands out of the way anyway. Okay, so scapulothoracic, what I'm going to do is put my hands right underneath the axilla here. So if someone's really ticklish, what I'll usually do is just put a towel between my hands and their skin, and that will help. But what we're going to do here is just look at how the shoulder blade is moving. So you can bring them up into elevation. You can bring them down into straight depression. Okay. Bring them forward into some protraction and rotation, and then back into retraction and add rotation here. Okay, so you're essentially just seeing how the scapula is moving. So if somebody's limited in end range motion, you have to make sure the scapula is moving, because if it's stuck on that thorax, that can really limit your end range motion. okay? So depending on where the limitation is, that's where you could then get in there and really mobilize it, okay? But here you have a much better handle on it than if I'm just back here and everything else is moving. So try to really get under the axilla, get close so you can use your trunk and do the movement. Okay, let's practice.